So anytime you're going into treatment, you want to understand what are the risks and the potential downfalls of the treatment. Most of the risks that happen with ketamine occur during the infusion, and that's part of the reason that I'm here and we monitor patients really closely here in the clinic. So when you come into the clinic, we will put an IV in, we will put you on a monitor where we record your heart rate, your blood pressure, and your oxygenation. One of the things that can happen with ketamine is it can cause your heart rate and your blood pressure to go up, and occasionally we'll need to treat that. One of the most common side effects with ketamine is nausea, and so we treat every patient before they go into an infusion with nausea medication, and we have multiple different medicines we can use to treat nausea during your infusion if you need that. And then one of the traditional side effects of ketamine is the altered state of consciousness that comes with that. Now, here at the clinic, we use that as a tool. But for some people, that can be a distressing experience if they're not ready for it. And part of what we do here in the clinic is we're there to support you through that process. A lot of times we can just come into the room and let you know what's happening, where you are, ground you to the environment. Sometimes we'll hold your hand. And what's nice about the IV infusion versus other forms of ketamine is we can stop the infusion if need be. We can also give you other medicines to help if you're having an anxiety response. However, most of the time, we don't need to do that. We can usually help you just through communicating and being there person to person. As far as longer-term side effects of ketamine, there have been some suggestion of people having some bladder inflammation from ketamine. However, that is based on data that comes from people who have abused ketamine recreationally, so people who are using much higher doses than we use in the clinic, with nearly daily usage over long periods of time. And of course, that's always confounded by the fact that there could be contaminated ketamine. And so there may be other, chemicals or other agents in there that are causing some of that bladder inflammation. So we take that information with a grain of salt, but it's still something that we'll monitor closely. But overall, ketamine's a very safe medication. It's been used for 50 to 60 years now in medical practice throughout the country. And we have a lot of experience with ketamine, and we know that it's an agent that is safe, and we know what side effects can show up. And that's why we're here, to make sure that you're safe during your infusion.